This medication is used to temporarily treat cough, chest congestion, and stuffy nose symptoms caused by the common cold, flu, allergies, hay fever, or other breathing illnesses such as sinusitis or bronchitis. Guaifenesin helps to thin and loosen mucus in the lungs, making it easier to cough up the mucus. Dextromethorphan is a cough suppressant that affects a certain part of the brain, reducing the urge to cough. This product also contains a decongestant, which helps relieve stuffy nose symptoms. It is usually not used for ongoing coughs from smoking, asthma, or other long-term breathing problems, unless directed by your doctor. Cough and cold products have not been shown to be safe or effective in children younger than 6 years. Do not use this product to treat cold symptoms in children younger than 6 years unless specifically directed by the doctor. Some products are not recommended for use in children younger than 12 years. Ask your doctor or pharmacist for more details about using your product safely. These products do not cure or shorten the length of the common cold and may cause serious side effects. To decrease the risk for serious side effects, carefully follow all dosage directions. Do not use this product to make a child sleepy. Do not give other cough and cold medication that might contain the same or similar ingredients. Ask the doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Robitussin cough and cold CF, be sure to carefully follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, take it as directed. You can take the tablet, capsule, or liquid form by mouth with or without food. Follow the dosing directions on the label, or take as directed by your doctor. It's important to drink plenty of fluids when using this medication unless otherwise directed by your doctor, as the fluid will help loosen the mucus in your lungs. If you experience stomach upset, you can take this medication with food. If you are using the liquid form, use a medication measuring device to carefully measure the prescribed dose. Do not use a household spoon. If your liquid form is a suspension, shake the bottle well before each dose. For sustained-release tablets or capsules, swallow the medication whole. Do not crush or chew them, as this can affect the drug's long action and may increase side effects. The dosage of Robitussin cough and cold CF is based on your age, medical condition, and response to treatment. It's important not to misuse this medication, as improper use, abuse, may result in serious harm such as brain damage, seizure, or even death. Do not increase your dose or take this medication more often than recommended by your doctor or the package instructions without your doctor's approval. If your condition lasts for more than 1 week, gets worse, or occurs with a headache that doesn't go away, a fever, or a rash, be sure to tell your doctor. These may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of Robitussin cough and cold CF may include dizziness, headache, nausea, nervousness, or trouble sleeping. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. If your doctor has prescribed this medication, it's because they believe that the benefits outweigh the potential side effects. Most people who use this medication do not experience serious side effects. However, it's important to notify your doctor immediately if you experience any serious side effects, such as mental or mood changes, shaking, weakness, or irregular heartbeat. While rare, a serious allergic reaction to this drug could occur. Seek medical help right away if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, be sure to contact your doctor or pharmacist. As for the best time to take this medication, it is typically recommended to follow the dosage instructions provided by your doctor or on the label. Be sure to take it as directed for the best results. Before taking Robitussin cough and cold CF, it's important to let your doctor or pharmacist know if you have any allergies or if you are allergic to any of its ingredients. Also, inform them about your medical history, especially if you have breathing problems, diabetes, eye problems, heart problems, high blood pressure, kidney problems, overactive thyroid, or trouble urinating. This medication may cause dizziness, and using alcohol or marijuana can increase this effect. It's advised not to drive, use machinery, or do anything that requires alertness until you can do so safely. Limiting alcoholic beverages is also recommended, and if you are using marijuana, it's important to talk to your doctor about it. The liquid form of this medication may contain sugar, aspartame, and/or alcohol. If you have diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires you to limit or avoid these substances, it's best to consult your doctor or pharmacist before using this product. Older adults may be more sensitive to the side effects of this medication, particularly dizziness, difficulty urinating, fast/irregular heartbeat, trouble sleeping, confusion, or mental/mood changes. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor, as it should only be used if clearly needed during pregnancy. Additionally, before breastfeeding, consult your doctor as this medication may pass into breast milk. It's important to be aware of potential drug interactions when taking Robitussin cough and cold CF. You should keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking certain MAO inhibitors with this medication, as it may cause a serious and possibly fatal drug interaction. Most MAO inhibitors should also not be taken for 2 weeks before treatment with this medication. Ask your doctor when to start or stop taking this medication. Be cautious of other products that may interact with this drug, such as rolapitant. The ingredients in this product are available in many other prescription and non-prescription products, so make sure to check the labels on all your medications carefully to avoid taking more than one product with the same ingredients. Additionally, this medication may interfere with certain medical/lab tests, potentially causing false test results. Make sure to inform your lab personnel and all your doctors that you use this drug. If someone has taken too much of this medication and is experiencing severe symptoms such as fainting or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can reach out to your local poison control center at 1-800-222-1222. Canadian residents should contact their provincial poison control center. Symptoms of overdose can include feeling agitated, confused, experiencing hallucinations, or having seizures. It's important to get help immediately if you suspect an overdose. It's important to follow your doctor's instructions and not share this medication with others. Make sure to attend all your medical and lab appointments as well. If you are taking this medication regularly and happen to forget a dose, take it as soon as you remember. However, if it's close to the time for your next dose, just skip the missed one. Never take a double dose to make up for the missed one. Stick to your regular dosing schedule. Make sure to store Robitussin cough and cold CF at room temperature, away from light and moisture. It's important not to store it in the bathroom or freeze the liquid forms of this medication. Remember to keep all medications out of reach of children and pets. When it comes to disposing of Robitussin cough and cold CF, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard this product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.